Karen says, hi Raf, if someone has had a herniated disc or microdiscectomy, which is just where they shave off a bit of herniated disc, herniation, as we said in the hiatus hernia, is where a part of an organ protrudes in or out of some body cavity, and a herniated disc is a disc in your back in between two spinal bones where the disc bulges out, herniates out into the spinal canal or some other part of the body. And a microdiscectomy is where they just basically slice off the bulging bit. So if someone has had a herniated disc or microdiscectomy a few years ago and no longer has pain, are there any restrictions on what they can do? How long after they feel okay can they do flexion exercises? Thanks, Karen. Well, Karen, the statute of limitations on discs is about 12 to 18 months. So, and that is because the discs are made of something called connective tissue, and the healing time for connective tissue is about 12 to 18 months. So, if you cut your finger, the skin will heal in a couple of weeks. If you tear a calf muscle whilst running, that'll heal in like 3 to 6 weeks. So if you break a bone, that'll heal in about 6 weeks, depending on which bone it is, but 6 to 8 weeks ish. And so there are, known kind of ranges of how long it takes various tissue types to heal. And connective tissue, which is the tissue that forms your spinal intervertebral discs, as well as your ligaments, as well as your tendons. Another name for it is fascia. As your Achilles tendon, for example, your rotator cuff tendons in your shoulders, your anterior cruciate ligament in your knee are all connective tissue. And all of those things take roughly 12 to 18 months to heal. So if you, rupture your Achilles tendon in your ankle, you would expect to, take 12 months to get back to basically, almost full strength. Same if you have an anterior cruciate ligament surgically repaired in your knee after you rupture it. It's about a 12-month rehabilitation process. So that's what I would expect in a herniated or microdiscectomy disc. So I would say for the first 12 months, you should gradually build load. And with all of these injuries that I referred to, so if it's an ACL rehab in your knee, or if it's a Achilles tendon tear, or any other ligament or tendon injury, initially, immediately after the injury / immediately after surgery, what you want to do is, for a short period of time, protect that tissue from load because it's just got a few sutures holding it together. But very quickly, like within a week, you want to start to load it very gently and gradually, progressively load it more over time. So it's not a case of stay off it for a year until it's healed, then load it, because actually the healing is facilitated by loading. The healing process, so all of these tissues, connective tissue, are made of primarily collagen, which is a protein that is secreted by connective tissue cells that live inside the structure. And so the collagen is a fiber, think like carpet fibers, right? And it's just protein, like hair. Hair is a protein. It's not collagen, but it's similar, but it's unlike hair. Well, it's like hair in many ways, but it's just way smaller, like, an order of several orders of magnitude smaller, narrower than hair, but otherwise similar. And so these collagen proteins are secreted. When you have an injury to your tendon or your disc or whatever, the cells in there, the connective tissue cells, start spewing out collagen to remake that tissue, and they spew out collagen, but it just all goes all kind of it's just a big pile of collagen fibers all mixed up together. And then as you apply load to that tissue gradually over time, the collagen fibers align themselves in line with the forces that are applied to the tissue. So if you gently load your injured Achilles tendon, it stretches the tendon in the way that the tendon is normally used. It stretches it out, and the collagen fibers start to align themselves along the lines of force that are transmitted through that tendon. And now when the collagen fibers are aligned along the lines of force, they provide greater tensile strength. They resist being pulled apart more when they're aligned along those lines of force. So applying load during the healing process is a crucial part of the healing process. If you don't apply load, the collagen stays disorganized, it doesn't line up. And after kind of that 12 to 18 month healing window, it's called the remodeling phase in high class language, that's when you have the opportunity to realign that collagen. After you've passed that, it's much harder to remodel that collagen in response to load. It can still be done, but it's not as responsive once it's fully healed. So the optimal thing would be, very soon after surgery, you would start gently loading, whether it's an Achilles tendon or a ACL in your knee or a disc in your back. And then gradually over 12 to 18 months, you would progressively load it more and more till by the 12-month point, you were fully, or probably even by the 6-month point, you were fully loading it. So, because even full load is like, think of like doing loaded sit-ups with a kettlebell, or doing the hundreds on the reformer with 3 full springs, right? I'm talking load. Even full load is nowhere near what's going to happen, what that tissue has to deal with in an unstructured situation. So just imagine you're playing sport and you're running and someone tackles you from the side, right? So some kind of unexpected explosive, situation with contact or falling or twisting or whatever. It's like that's what the tissues have to be able to deal with. So that's what they have to be able to deal with by the end of the healing process. So by about halfway through the healing process, they should be capable of, dealing with full normal strength under controlled conditions. So for instance, if you're rehabilitating an anterior cruciate ligament, 6 months into rehabilitation, you're not ready to go back to playing football, but you are ready, or you should be ready if you've been doing your rehabilitation properly, to do hopping and, one-legged squats with a barbell. Like you should be doing strong work. So for your client, Karen, who had a microdiscectomy a few years ago and has no pain, I would say just treat them like somebody who hasn't flexed for a while, if they haven't flexed, and just start easy and build slowly. And just treat it like, building up strength in their back, basically, building up strength in their abs, increase over a few months until they're working up a really good head of steam and, doing super impressive moves. And if they don't have any pain, I would just never mention it. I wouldn't ask, how's your back? I wouldn't say anything about it. I wouldn't mention pain. Just make it not a thing. Talk to them about other things. Keep their mind off it. Focus on how many more reps do you reckon you can do. Great, you're doing awesome. High five. So that's what I would recommend. Hope that helps, Karen.